Bonding dentists together is our favorite thing to do at Dentist Job Connect to help them unlock more freedom, more free time, and most of all, fewer hygiene checks. If we can help you, just text HIRE to 215-798-9897 or visit us at dentistjobconnect.com. If you would like to check out 300 plus open associate dentist positions on our platform, text jobs at 215-798-9897 or visit dentistjobconnect.com. I am so thrilled to have these guests on with me. I'm going to bring out my basketball because you guys are a team, and I'm going to talk with this amazing team from Village Dental Family. I'm going to start with the practice, and I'd just like to share who you are, when you graduated from dental school, and what you do in your daily life. I'll start with Dr. Maya.
Hey, Dr. Goodman, thank you so much for having us on. Since you have the basketball, I don't know that I shared with you, but I did play basketball at Carolina.
Oh,
So
wow. That's impressive.
Yeah, so that's probably my claim to fame here.
I love that.
But yeah, we're in Raleigh, North Carolina. We have 4 locations and 14 amazing doctors, and we're looking for a few more. And I'm really excited that we were able to connect with Dr. Sifrig and Dr. Ruhala through you guys. So can't thank you enough for that.
Awesome. Before you came on, I'm going to start with the person I'm jealous of, Dr. Jessica, because she's just traveling and doing dentistry. That's the 2 things she does. So I see her on Instagram and Facebook around the world. But Dr. Jessica, when you're not traveling to fancy and or dancy places, tell us about your dental life.
Yeah, hi, I'm Dr. Jessica Sifrig. I graduated from University of Florida in 2019, and I've been working at Village Dental with Dr. Martin since 2022. So it's been 2 years now. I did one of these interviews when I first started in this job because I found this job through Dentist Job Connect, and I have been loving it for the past 2 years. I do a lot of different things. The things I've been working on in dentistry lately are implants. That's newer to me. So the past year I've been working on some cool cases. So looking to learn more over the next few years.
I love it. I love dental implants myself. No one complains about the color of the implant in their bone. It's very relaxing, unlike some of the other things. And Dr. Christina, share with us a little bit about yourself.
Yes, thank you, Dr. Goodman. I'm Dr. Christina Ruhala. I graduated in 2019 from Detroit Mercy. I've been with Village Dental for a little over a year now, which feels like a blink of an eye, but also my whole dental career all in the same breath. What I've been really enjoying is complex, comprehensive cases, full mouth rehabs, which I didn't really do much until I came here. So I just have to say I've learned so much in this past year. I only wish I found Village sooner.
Awesome. I love shares like that. I was at a conference recently, and they asked me to talk on a panel about, what motivates associates to take a job. And I said, it's these 3 M's, money, mentorship, and morale, right? And they could be different to everyone. Some people are looking for a high level of mentorship, and if they don't make as much money, great. Some people are saying, I didn't make as much money as possible. I don't need mentorship. But maybe, Dr. Maya, just kind of talk about the mentorship offered in your group. What does that mean to Village Family Dental? How does that show up when associates are working with you?
Well, our number one core value is never stop learning. And Chris and I both are definitely wired that way. So we just love working with our doctors and passing on all the mistakes that we have made over the years. Between the 2 of us, we have 50 years of clinical dentistry. I just did the math a few minutes ago.
Awesome.
And you feel bad. But we're both MAGDs, and we're just really, I call us dental geeks, but, and I say that very proudly because we just are so passionate about clinical dentistry and learning, and we just really enjoy doing it, which I know makes us sound a little weird, but we really love it.
Well, we went to dental school to be professionally weird. So we're all in this weird world together. And I also share, we just had Super Dentist Boost Camp, and the theme was be a role model and find a role model. And I think it's awesome that you share when you do things like get your MAGD and care so much about continuous learning, you're a great role model for associate dentists, no matter where they want to go, whether it's be an associate for their entire career, buy their own practice. And some of the things I share on these interviews is to educate them is, you want to be doing your associate dentisting, I call it, in a place where you would want your family to be treated as a dentist, where you'd want to go. And sadly, that's not always the case. And I think it's just such an important thing to remember when you go for an interview or you see people, hey, can I learn from this group? And is this the type of place I want to be in? I'd like to ask Jessica and Christine a little bit. Let's say a dental student's watching. And, in dental school, maybe you thought you knew it all, maybe you didn't, but then the real world happens and you learn something. What's something like you think a dental student should know now? You're a D3, you're a D4, and you're like, I wish I knew this to be a successful associate. I should have paid more attention to this. I'm glad I took C in this. It could be anything small, medium, or large, but I just love people sharing that. I'll start with you, Dr. Jessica.
Yeah, so there's obviously a lot that you learn in dental school, but there is so much more that you learn when you leave dental school. And I think one of the biggest things is remembering that in dentistry, you get humbled on a regular basis, and that's part of the experience, right? So you can feel really good about that molar endo that you do, and then all of a sudden something humbles you.
Yeah.
And just remembering that it is the practice of dentistry and that we are always learning and always being surrounded by people who you can run things by, which is why I love Village. You know, there's a lot of dentists with more experience than me in different things, and being able to have a case and run it by Dr. Martin or Dr. Chris Martin or any of the other doctors just to get another look at something and know that I don't know everything. So coming out of dental school, you just you feel like you've learned it all. But there's just so much more to learn, and being really open to that and being humble and knowing that our main goal is just to do the best for the patients, and just keeping that in
I
mind.
love that. Two things I'll add to that is, when you first have a baby or a child, you want to know, is this normal, right? You want to ask other parents, is what's happening to my baby normal? How they're sleeping or eating? And I think you think the same thing of your career with patients. So when you can have someone to ask you, is this normal question? What should I do next? And I also remember you sharing back in 2022, because the pandemic was a big part of it. You also said you used our Dental Nacho C on your phone to learn things you could use. And I want to share, as someone who's older, I didn't have any of that. I had a Hotmail account and 4 friends. So dental students, there's so much awesome C you can pay attention to, whether it's dental nachos or otherwise. And one of the things I share is when you watch someone present a C course, whether they're talking about veneers, they always infuse their life into it. They infuse what they did. And when you can kind of just pay attention to what you're going to be like in the real world, that's so key. So I appreciate you sharing that. Dr. Christina, how about you?
Well, it's pretty similar in my experience as well. If I could look back at D3 myself, I remember thinking, I'm going to learn everything in here and I'm going to go out and just attack the world. And then even my first week of being a licensed dentist, I learned so much. I learned how to talk to people. I learned that, oh, not everything's a perfect class 2 box in the real world. Like you gotta learn how to adapt. The world is always changing, and camaraderie is huge because what we do is really hard. It humbles us every day, it builds us up. But there's something about talking with your colleagues and going over tough cases that to me is very invaluable. And as much as you want to show your beautiful root canal to your patient, they're only going to appreciate if they're in pain or not anymore. They don't recognize that beauty that we get. And it's really nice to have colleagues that are like, oh, did you see that little puff? Oh my God, that looks great. You don't get that from your patients, but you get that from, the colleagues of people that know how hard it is to do what we do every day.
And what I love about both you sharing, 5 years into your career, one year will be 15 years, 25 years, is that you need people on your side because it's an emotional roller coaster that you can't get off of. And what I think is crazy is you could walk into one room and someone can say, you know what, Dr. Paul, you're one of the best dentists I've ever had. I love coming here. I say, thank you. I walk into the next room and they open them up with, I just want to let you know I hate you. I go, could you come into the other room? Someone else likes me over there. And I actually share, it's very difficult. You got to be an emotional ninja. You got to be understanding of this. And it doesn't matter, Maya, whether you've been doing this for 25 years or 5 years, it still can impact you. And I think it's so key when you have people to share that, what I call crying inside feeling, what I call the Mr. Grumblies that happen, in your eyes. So Maya, I want to go to you next. And I think this is key for Village Dental. You've been an awesome Job Connect supporter. This is your time. Like, what qualities do you look for in an associate dentist? Someone's watching and say, I want to apply, but I want to make sure I'm a fit. It could be clinical, it could be personality type, it could be anything. Tell us about what qualities you look for in an associate.
We're definitely looking for doctors that are very passionate about dentistry and would almost do it if it was a hobby. Almost, if you're not getting paid, would you still do it and actually enjoy it? I know that might be a little bit of a stretch, but people that love just the craft of it and also are humble. Most people that go to dental school are super smart, no question about it, passed a lot of tests, gotten lots of good grades, but you still have to have that humble, the fact that the learning never stops, right? So if you have that mindset, you're good to go.
I think it's a great mindset. It's just because as someone who's now done things inside of dentistry and outside of dentistry, there's just a lack of predictability in what we do with patients that can just drive you, technical term, nacho nuts. So you have to just keep striving and realizing that it's a journey, not a destination. And I think too often, this is not to be the older dentist, Jessica and Christina, say these younger dentists don't get it, but constant learning is every year, investing in CE, going to conferences, paying attention to things. I want to ask you, Maya, too, whether you're talking to a practice owner who's thinking of their first associate. I had the pleasure of talking to someone you mentor, Dr. Andrew Sugg, who's hiring a second associate. Has hiring associate dentist, how does it help you unlock more freedom, flexibility, fuel growth? Talk to a practice owner who's like, I don't need an associate, I'm just going to do it by myself. How has it helped you personally build what you want to build?
Oh, it's been an amazing journey. Dr. Sugg that you just mentioned was my first associate back in 2013. And he's a great guy. And just having him on board at the time, I was so busy, and I was just grateful to have anyone that can just help me, not run around all day long. And then from there, we just kept bringing more doctors on, and I would learn from them as much as they would learn from me, just having someone to collaborate with and share the burden and do the dental confessionals, I call it. You know, if you just have someone that you can share those successes, but also some of those stressors, makes things you know, half difficult, or, you know, what is it? Joys are doubled and sorrows are halved, right?
For sure.
But also, as we get older, there's a really good book. It's called oh gosh, I can't think of a name right now, but he talks about aging and how, you know, you can forever do what you could do. And there's definitely a point that in dentist careers that you start to, you know, your eyes start to go bad or your back starts to hurt. And it's really nice to be able to back off a little bit and have these young guns take over and, you know, be as good as you once were. So it's kind of a hard thing to accept, but it's inevitable.
And it makes dentistry more fun, and it's not illegal for dentists to have fun. My good friend, Dr. Todd Fleischman, who I encouraged to hire an associate in 2017, and by encouraged, I said, you better do this, you're going to be miserable. I kindly annoyed him. He said, I'll never go back to practicing alone. And, you know, right now he has a solo office with 2 part-time associates, but, you know, the camaraderie that gets created by doing it. And Dr. Stephen Rasner, who I think I mentioned, he's an amazing dentist. He has Lionhearted podcast, one of my mentors, incredibly financially successful as a solo GP, but he said, you just don't have the flexibility. And, you know, there are dentists watching this right now who have 0 income problems and very high flexibility problems. It means they can never take a day off or take the vacation. So I think that's key. I want to ask Dr. Christina and Dr. Jessica, you talk to a lot of dentists at your ages and stages. What are some of the things, and, you know, you're allowed to be so happy where, what are some of the things you get to do as associate dentist? Not to say they don't get to do, but maybe cool things, whether it's sedation, whether it's, you mentioned full mouth rehabs. I'll start with you, Dr. Christina. Maybe things your friends might be dentisting jealous of.
It's the sedation dentistry. That was one of the big draws to Village for me, because there's so many people you can help with sedation that I had patients in Michigan, where I'm from, that I would refer them to all these offices, and even then they weren't getting help and they really needed sedation. That was the answer. So when I saw the ad for Village Dental and saw how much more people I could help, and even the people who do go to the dentist but, you know, just want to be more comfortable or don't remember these experiences, because dentistry isn't the most comfortable thing to sit through, let's just say that. So that is something I do talk about in depth with my friends and colleagues back in Michigan. They're like, wow, that is so nice. And I don't have to deal with as many bathroom breaks anymore.
Yeah.
And in the middle of trying to find MB2, that's really, really nice from a provider's point of view. So the sedation part, I think, is the big
This is a funny joke. I love you sharing that. So I don't know if you've ever heard him say this. I want to give him credit, Maya, but Dr. Mike Totola, kind of the, you know, famous Glidewell speaker and the Verse Crown Prep, he came to lecture for my group, and he made a joke that I just laughed at. He goes, dentists are the only professionals foolish enough to work on our patients while they're awake, right? And if you think about it, it's pretty true, right? We're doing something that's incredibly annoying. And I know you can't sedate every single patient you ever see, but having that for, I'm sure, a larger case here. Dr. Jessica, how about you? Whether it's sedation or implants, what are some things that maybe cause your associate dentist friends to be dentisting jealous in a fun way?
Yeah, so I want to expand on what Dr. Ruhala actually just said. So I agree on the sedation from the point of patient comfort, obviously, but also from the point that we get to do bigger cases because our patients are more comfortable. So what a patient that was awake may not necessarily do in one day, we can do in one visit, because one, they're comfortable. We are able to kind of, the way our practice is set up, we can actually stay in the room for almost all of the appointment without having to step out to do hygiene checks, new patients, all the other parts of our job, because we are a group practice. So if I have a big case, like Dr. Hall was talking about, like a full mouth rehab or doing an anterior case, I can say, hey, I'm going to stay in this room. This patient's sedated. We're going to get this all done in one day. Patient's happy. We're happy. So I feel like it's allowed me to expand on what I'm comfortable doing. And, like Dr. Ruhala just said, that MB2 that's tricky to find, I feel comfortable bringing in Dr. Martin if she's there to say, hey, lay your eyes on this. Am I in the right direction? Am I going the right way here? And the patient is sedated, so they're not, they're not concerned about it, because, bringing in an extra set of eyes doesn't mean you don't know what you're doing.
I
It's
love
just
that. I wish
the
you could
benefit
say
of a
that again. I
mentor.
want to pull that out of it. One of the things I find most challenging about dentistry that I find very unfair is that in other areas in life, we think we're getting the best service possible when they bring in more people. Oh, you're at a medical residency. If they said back there, we have 3 chefs working on your dish, like maybe more chefs should do it, right? But for some reason in this dental world, it cuts both ways for me. One time my own brother couldn't get his long-term crown, I'll say final, off after he tried it in. And he's like, Paul, I don't know what to do. It's like, it's stuck on. And I just walked in, I joke, I'm an older brother. I didn't know what to do either, but I was able to twist it off. So I said, oh, of course, I'm the stronger brother. And we laughed it off. But it was just kind of stunk that it was such a big production where my brother was doing the right thing, asking for help. So I think that you have this opportunity just helps you push your own comfort zone in a responsible way. And I think that is awesome. Dr. Maya, I want to kind of go through here with some time, but let's just say we use this portion of the interview to talk to the associate dentist who's going to join this 14 dentist team. And even if we have done this, I always say, I don't repeat myself, I reinforce good ideas. So these are my 5 questions that I recommend practice owners be ready to answer, and Christina, Jessica, and associates be ready to ask. So where are you located, Dr. Martin?
We're in Raleigh, North Carolina, which is a great place to live. It's often voted one of the top 2 or 3 places in the whole country. So it's super fun.
Awesome. And how are the associates compensated there? So some dentists, Maya, we're cool, medium-aged dentists, but some are a bit yelly. They go, oh, my dental school was also expensive. I said, not this expensive, right? They're going to. So I think it's normal for new dentists to be concerned about how they will earn enough money. I don't know, Christina and Jessica, they're very entitled, these young dentists, Maya. They're so entitled. I've heard these young dentists are so obnoxious, they want to do things like eat food and have shelter. What kind of entitled people want to eat food and have shelter? Well, it's normal to want to eat food and have shelter. So talk to us a little bit about the compensation, how it works for you.
No, I think it's definitely reasonable for young doctors to come out and have expectations of certain income, and they've spent a lot of time in school and they've learned a lot of stuff. And I think the biggest thing is how busy is the practice is really what the question should be, because people often get stuck on the percentages, but it's really 0 of nothing. I mean, 100% of nothing is nothing, right? So it's how busy are you? So all of our doctors produce an average of about 100,000 a month.
Awesome.
Which is, I think, there are variations. There are some of the more experienced doctors that produce 120 to 140. I have found that some over 140, unless you're doing a lot of all-on-4s and really, really large cases, the general dentistry starts to kind of drop on quality a little bit. So I like to keep them right around that 140 a month range. But we stay really busy. Our doctors stay really busy. This year has been a little wacky, so we're a little bit down from last year, and I don't think we're the only one in that. But for the most part, we stay busy. We see about 40 new patients per month per doctor. So our doctors get paid on their production, and we don't have hardly any adjustments. So what they produce is how they get paid, and it's a scale percentage. So the more you produce, if you're over 100, you get the highest percentage production. So we don't really have doctors complaining. A few doctors that look at our agreement ahead of time look at it, and they're a little hesitant because they don't exactly know what that will look like on the back end. But I encourage them to talk to our doctors, and I think
I think that's awesome. And what you have there, Maya, for me to interject, just tell people now, you don't interrupt, you just interject with brilliant ideas. That's what I do. But I wanted to interject because I know this world is, you have a track record of associates who, they happen to be on this actual interview with us, but you can also say I have a track record, and it's reasonable, I'm sure, for your associates to earn over $200,000 a year. if they are producing that. I think that's just a really well outlined way of what to expect. And, you're being honest about the whole thing. I think, one of the things, Jessica and Christina, we can, because I'm enjoying this. How much did they train you in dental school about like how you get paid and what percentage you make and what to ask during dental school? Or was it just Krebs cycle and kidney all the time? Christina, do you have a lot of classes on compensation, or was it kind of confusing?
There might have been a one lunch and learn for 20 minutes in between exams where we got some free Subway.
Yeah.
And I don't think I probably paid attention, or it probably was about retirement. There was no classes, no strategy. There was no communication in dental school about communicating after you graduated.
And when you don't know, you just get confused. Was it similar scenario for you, Dr. Jessica?
Yeah, we did not learn anything about contracts, negotiations, what we should expect to produce, production, adjusted production. I actually think I learned most of that from you, hiring a lawyer, like things to look for in your contract. You don't learn that. And you learn when you make the mistakes early on in your career where you're like, oh, I probably should have gotten a lawyer for that one. And
it's also just, right. And it's just, it kind of set you free without the tools to stay sane. And that's why I hope we deliver value in doing this. And all of, your two faces on here, because we're older than you guys. So when they hear from you saying, hey, pay attention to this sooner, listen to podcasts, take CE. So you just hear these words about what you should be asking for. Now I'll ask you two, in terms of procedures, we talked about sedation and we talked about implants, but I have a surgical prosthodontist and he does all on fours, but that's not all he does, right? He also does fundamental things that help teeth chew and smile with confidence. So kind of what procedures are you expected to do, or you do? I'll start with you, Dr. Jessica, as an associate for Village Dental.
Yeah, so we do, a lot of the core procedures, crowns, root canals, extractions, fillings. We also do, I really like clear aligners. So I like to do a lot of clear aligner therapy. We work with ClearCorrect. And the newer things for me are wisdom teeth and implants. So I kind of shied away from surgery early on. So those are the things that I'm challenging myself with now.
Oh.
But the nice thing is we do a little bit of everything. We very rarely refer out, only like certain circumstances. So it's really nice to be able to keep everything in office.
Love that. How about you, Dr. Christina?
Well, a little bit more background about me. When I graduated, my first 3 years of my career, I did strictly bread and butter dentistry. So when I came to Village and learned that I would be exposed to all these disciplines that I hadn't touched since dental school, I was salivating at the bit. So if you come to Village, you're going to have the opportunity to do what you want to try. We have so many doctors here with so much experience that if you've never done wisdom teeth, like I did not do that since dental school. So I have been doing wisdom teeth since I've been here and I've gotten more comfortable with it. If you want to do implants, if you want to do molar root canals, the world is your apple. I don't know what that
I like that
is anymore right now, but whatever you want to do, we have amazing mentors here, people who have been practicing for almost my whole life, really. And that
I say that as much as possible to them. I'm sure they love that when they say, oh, thank you for your experience. I wasn't born when you started doing dentistry. So yeah. But I think that's awesome. It just talks about this network and team, to use the basketball example. If you can pass the ball, they can show you your form. I mean, I just think we need more of that. I actually really, Maya's one of my favorite people, but I just compliment her for creating this. I did a 3-year GPR and I worked inside of a hospital. And I just really saw how amazing their little teams were, from gastroenterology to urology to OBGYN to orthopedic surgery. They can follow each other around, small doctor, medium doctor, bigger doctor in their experience, and they all turn to each other. And there's probably so many problems with the medical world, but their training is just one that's based on turning to somebody and saying, help me with this. And I just think it's so cool that someone came with fundamental restorative dentistry skills and is now learning other things. Maya, tell me this. What is the schedule and hours like in general? I know it might not be this way forever, but if someone's like, hey, this sounds great, what type of schedule and hours do your associates work?
Most doctors work 4 days a week. We have a couple that are working 3 days, so it is an option to do that. And it's typically 7:20 to 5-ish, depending on the day.
So 4 days a week, 7:20 to 5.
We have a dedicated training time. We don't start seeing patients until 8. So from 7:20 to about 8, we train with our team every morning.
Nice.
And that makes practice of dentistry a lot more enjoyable, as you know, Dr. Goodman, when you have support, well-oiled machine support team around you, it makes things a lot less stressful. So our doctors definitely help us train our team, and we appreciate that.
I love that. I mean, one of the things I'll share is someone who, started 2 companies that I made up in my head, and one named after an appetizer. Dentistry is so complex to execute with all the things you need, from just the setting of things up to what you need next to all of the materials, that I think it's awesome that you take that dedicated time, because even when you're doing it all the time, things can become confusing. Someone can forget something. So I really compliment that. Now, my last question to all 3 of you before we end is, dentists are people too. Some people don't think we're people. They think we're just like the teachers that live in the back of the classroom. We live in our operatory. They see us at the grocery store. They run the other direction. But we're people with real feelings and real emotions. So for the next 98 seconds, pretend you never went to dental school. Pretend you don't know what mesial means. Pretend you've never memorized the Krebs cycle before. And I just say, hey, if you're in Raleigh, what's something really fun to do? If you are treatment planning fun, we set a course from restaurants to museums to hiking. You said, hey, if I move to Raleigh or wherever you guys are in this general North Carolina area, for context, what is something fun that you really enjoy to do as a regular person, nothing to do with dentistry? Jessica, I'll start with you.
So Raleigh's awesome. I've been here about 2 years. I moved from Dallas, and we love the food, the bars, the whole dining experience. Christina, Dr. Ruhala, is one of my friends. So we do like a monthly girls' night with a couple of the doctors. So we love that scene, but I also like the convenience being we're about 2 hours max from the beaches and a few hours from the mountains. You can go skiing on the weekends, you could go to the beach on the weekends, and it's just a beautiful place to live. Like, you haven't been to Raleigh in the fall or the spring, it's incredible. So we've been loving it.
Awesome. Christina, how about you? Anything you want to add to the menu of fun?
I'll build off of that. One big thing for us was that there was an airport here. I'm from Michigan. We wanted to be able to fly back home if need be, but we wanted to get out of Michigan, enjoy some southern warm weather, and we love being able to go to the mountains and going to the ocean. I have a 2-year-old son, so life is a little bit different than it was a couple years ago. And raising a family here is so exciting. There's so many young families nearby. There's so much diversity here. And when there's a lot of diversity, there's a lot of new restaurants. I've noticed
That's awesome.
hand in hand. So
Congratulations on
area.
your
Absolutely.
congratulations on your long-term non-paying roommate that you have in your house now. So,
I know, and slobber everywhere. It's great.
And Maya, you've been there. Anything you wanted to add to the menu of fun there?
Well, I know you'd appreciate this, Dr. Goodman. There's lots of amazing basketball. There's Duke State in Carolina. It doesn't get any better.
And you guys have the same thing in Philly with the rivalry. I was actually down there. I wish I saw you guys. I'll talk to you after this. I was at the NC State campus, and but I was speaking for a group that's Carolina blue, and I happened to say something nice about Junior NC State. They didn't like that, and brought me back to the Steelers Eagles type of rivalries. Well, you guys have shared so much. I just want to wrap up by saying people can text Raleigh to 215-798-9897 to apply to this position. They can email us at info@dentistjobconnect.com. And if I can be that kindly annoying mentor to anyone listening, Christina and Jessica, why are you glad you paid attention to Dentist Job Connect? Should dental students get on it sooner? I think it's never too early to start planning your decision after dental school. Start learning what's out there. Kind of share with us, would you recommend people pay attention to Job Connect, and how has it helped you? Christina, you could start first.
I loved it because I was at a point in my life where I never thought I would relocate. So what I loved about Dentist Job Connect was that these are opportunities all over the country. And yes, you can filter it to around you, but I don't know, like just take that jump. I haven't regretted it. It's been amazing. And I loved the ease of how easy it was to go through the app and search through everything. So
we really appreciate that. Dr. Jessica, how about you?
Yeah, so I was also relocating when I found this job, and looking at jobs, like if you look on, all the job search engines that you can look at, you don't know what type of doctor is running that office, right? But knowing that someone chose to go through Dental Nachos and go through you to post this job means that they're people that like to learn, that they truly love dentistry, that they have kind of the same thought process that I had when I was using your resources. So I kind of thought we probably are like-minded, and I like the job description. And honestly, reaching out to Dr. Maya was really easy. I think I actually texted her because on her original video, she had included her number or email or something. And it made applying for the job less stressful, more approachable. So highly recommend.
Love it, Jessica. Well, I want to wrap up with, so I watch a lot of videos on TikTok and I got some parenting advice. And a dad was saying that, many of us were told by our coaches, our leaders, our faculty, that I'm so proud of you for getting a good grade. I'm so proud of you for getting into dental school, but we really should change that, how we talk to our children, how we talk to our team members. And instead of saying, I'm so proud of you, I really try hard with my daughter to say, you should be so proud of yourself. You should be so proud of yourself. So you should be proud of yourself for creating this group where dentists can learn, laugh, and feel less than alone. I'm honored to have you as part of Dentist Job Connect. Anything you'd like to share before we wrap up?
I just appreciate you, Dr. Goodman, and this community you have created is really amazing. I don't know how you find the time to make it all work, but it's really wonderful. Thank you.
My
And
pleasure.
thank you, Dr. Sifrig and Dr. Ruhala.
Well, hang around with me for a minute, guys, but thanks so much for sharing with us today.